it is recreational drugs. Don't use the word drugs unless you are talking about the recreational drugs. You just use the word medications.
Thank you very much. I appreciate it. So it's very nice of you.
No, I was talking like a Swami. I was not talking like a patient. Okay.
So when the results of the sputum test is out in about 2 or 3 days, we would cross-check to be sure. We'll cross-check to be sure whether the medications you are on are the best medications for you, and then also based resolution of these complaints that you came with. It will help us have an idea of whether you're on the right drugs, right medications, I beg your pardon, or whether we need to change the medications. Is that okay?
Yes.
Okay, and then we'll need to see you again in a week's time to follow up and know whether you're getting better.
You will come to me after 1 week.
But you need to come to the hospital
I need to come. I'm in the hospital now. I'm in the hospital now. Are we in the hospital now, doctor?
Okay, so well, we need to admit you in the hospital now. Is it a GP clinic?
You're in the hospital now.
Okay, so we need to admit you to the medical department of the hospital, where you'd be on treatment and observe you, and then when you get better, we most likely discharge you. And when you get home, you need to come back to the hospital for follow-up visits. Are you following me?
Yes.
Do you have any other concerns? Do you have any other questions you'd like to ask?
How long you think I should be in the hospital?
Well, I will not be able to say exactly how many days you'll be in the hospital, but there is a chance that if things go on well, you will not be in the hospital for more than 4 days. But I'll need to ask my seniors to confirm. Is that okay?
Yes.
Okay. Do you have any other concerns?
Yes.
Okay, please go ahead.
How long do you think it will take for me to improve?
So within 2 days, 3 days, you will start getting better. But by that time, you then need to come.
When will I be completely better? Normal.
Completely, you should be normal within a week. Any other concerns?
Yes.
Okay, please go ahead.
Will you have any problem in the future with this condition?
Well, based on what you have presented at that moment, it's not likely that you will have any problems, though there are the chances that some people have complications of this condition. Would you like to know some of these complications?
No. But that's rare, you said, right?
They are rare.
No, I don't want to know.
Do you have any other concern?
No, doctor.
Okay, so it's very nice of you presenting to the hospital quite early. I'm sure that we are going to take good care of you.
Okay, thank you. How did you do it? How did you do it? Great, good. Okay, all of you said great. Now, I want you to tell me what are the great things that did. Examination, we said. Yeah, now, what is initially what I wanted to tell him is only provision diagnosis, but he told us everything. But we'll discuss step by step. Now, first thing is the provisional diagnosis. So, how do you talk about the provisional? Mr. Smith, with what you told me, what is that? History. Don't say then with your history. Don't use the word history to the patient. There's no history geography when you're talking to the patient. Okay, so even when you're taking history, don't ask, do you have a past history of this? Do you have a family history of this? Do not use the word history when you're talking to the patient. History is the word what we write on the notes. Okay, not to be used. Okay, so just telling with what you told me, and after examination, I think means provisional. Okay, I think, or I suspect. Okay, I think, or I suspect that you have a condition called pneumonia. Okay, so that means when you give the diagnosis, will you use a medical term or a non-medical term? Use a medical term. Okay, so I think you have a condition called pneumonia. Okay, so you use a medical term, whatever it is. Okay, whatever condition it is. So use a medical term, then give the diagnosis. I think or I suspect, or there's a high possibility that you may have be having this. You can use any word, whichever word you want. Now, once you name the diagnosis in a medical term, what do you do next?
Explain it.
No. Explain that? Yeah. This is what happened to me. Patient is about 65-year-old man. So he had pneumonia, same thing I was telling you, pneumonia means there is some bugs in your lung. And he told me, doctor, I'm the retired respiratory consultant. Should you tell him what is a pneumonia to him? No. Can a doctor come as a patient?
Yes.
Can a nurse come as a patient? Do you really have to explain all these things to them? No. Sometimes you, the patient, even a non-medical person may know about that. How? Probably they already had the condition before, or their relative would have had a condition before, or some of them they would have. What you normally when people have any symptoms, what do they do before they come to the hospital? Google. They go Google it. They know everything about it. They know more than you. Okay, so that means once you use the medical term, I think you may be having this condition. What is the next thing you do? Do you know about it? Okay, do you know anything about it? Do you know about this? First, you find out whether he knows anything at all. Because sometimes they know, oh, doctor, I know everything about it. So then you don't have to explain. But what do you think happens in the exam? He'll say no, because he wants you to explain. So what do you do after that? Then you explain. Then you explain. So here what you said is, I think you may be having condition what you call as pneumonia. Do you know anything about it? I said, I don't know. So then tell him, pneumonia means there's some infection in your lungs. And when you talk, where do you keep looking? Look at the patient face. Why? Look at his expression. Imagine he looks at you, you have condition pneumonia. Do you know? I don't know. Okay, so you have infection in your chest. What does that mean? He didn't understand. So what do you do? Yeah, means there are some bugs or germs in the lungs. Okay, explain. Once you explain, what do you do? Check the understanding. So, do you follow me? Do you understand? Do you understand or do you follow me? Check the understanding. So never ever move on to the investigation or anything without making sure he understood the diagnosis. Now, as I told yesterday itself, in the mark sheet, some of them, the examiner marked for a diagnosis. They marked for the diagnosis. What does that mean? If they mark for a diagnosis column.
Did he explain the diagnosis?
Either the diagnosis was wrong, or you told the right diagnosis, but you did not explain properly, or you explained it, but you did not check the understanding, or you did not tell the diagnosis in a proper way. If it's a breaking bad news, there are ways to give the diagnosis. Okay, so if they mark for the diagnosis column, it does not always mean if the diagnosis is wrong. It can either the diagnosis is wrong, or the way you told the diagnosis is wrong, or you explain it wrong, or you did not check the understanding. So that means all these things, steps are very, very important. Use a medical term. Do you know about it? Explain that. Do you understand? Is it important? Very, very important. Do you understand that? Now, when you tell a diagnosis to the patient, what do you think the most important thing the patient want to know about that diagnosis? If I tell you that you have this condition, if you're a non-medical person, what is the most important you want to know? Is it curable or not? Or what do you think the first question patient will ask you? Doctor, is it serious? Is it serious? It's very, very important to say, is it serious? Most of the time, the patient himself will ask you, doctor, is it serious? Okay, so then you need to say whether that is serious or not. But even if the patient did not ask you, If it's something serious, you must mention to him. Unfortunately, it's a very serious condition. Okay, so okay, so please tell them if it's serious or not. Or even if it's not serious, you could say not a serious condition because this is easily curable. We can treat it easily. Okay, say that. That's very, very important to say. Is it serious or not? Now, there's no point you telling the patient it is serious or not. You need to say what is the seriousness. For example, imagine you say you have a condition, what do you call it, giant cell arthritis. Do you know anything about it? No. Means that in this condition, there's some inflammation, there's a swelling or a soreness of blood vessel at the side of the head. Yeah, which can cause problems like what you're having is a headache. That's what you call a giant cell arthritis. Unfortunately, this is a very serious condition. What is going on in the patient's head now? You think he may die. So is he going to die? No. So what do you need to say? You need to say what is the seriousness. Okay, don't simply say seriousness. You may say what is the seriousness? What? Yeah, because sometimes it can cause permanent blindness, which can happen suddenly. So that means there are so many things to say in the diagnosis. And not just the diagnosis, explain, understand, and is it serious? If it is serious, what is the seriousness? Okay, so now then you move on to the next step, which is investigations. So how will you tackle the investigations? So what he told initially, I suspect this. Now we say, well, to confirm this, to confirm your diagnosis, to confirm our diagnosis, to confirm that. Okay, so we need to do some tests or we need to do some investigations. Okay, to confirm, we need to do some investigations like. Okay, so then you need to name the investigations. Most of the time, investigation starts with what? Blood investigations. Okay, start with the blood. Will you tell the patient we'll be doing full blood count, urine electrolytes? No. Do you think the patient will understand? No. So that means you need to talk in a way the patient can understand. So how do you talk about the blood test here? We'll do some blood tests to check for infection markers. Enough. Okay, we'll be doing some blood tests to check for infection markers. Okay, so I'm just giving an example here for the pneumonia because it's different station, different things. Okay, so we'll be doing some blood tests. That is for one is for infection markers, and what other important blood tests you'll be doing to check for what kind of bugs. To check what kind of bugs are causing this infection. Yeah, that's what test you're talking about? Culture. Okay. Then, of course, we'll be doing a chest X-ray. Do you think the patients know about X-ray? Yeah. Everybody knows. Everybody, you don't have to tell. It's a photo. Okay, everybody knows what is X-ray. Then, what other important tests? We'll have to test your sputum or a phlegm. We have to check your phlegm or test your sputum for any bugs. What kind of bugs? You have to check your sputum or a phlegm to check for what kind of bugs is causing this problem. So name the investigations. Name the investigation. Once you name the investigation, what is the next thing you do? Check the understanding. What if you didn't understand what you're talking about? In fact, you need to check the understanding of each of that. Blood tests. Do you understand? Yes. Chest X-ray, phlegm. If you don't, at least look at his face. See, keep looking at his face. You will know whether he's understanding, if the expression, you will know. But once you finish all the investigation you want to mention, then you must ask this question. Do you follow me? Do you understand? Do you understand? What is the other important thing you need to ask? Well, other important thing you have to ask. Is it okay with you? Why? Consent. Yeah. So patient has to give a consent to do investigation. You can't simply take the blood of a patient and do investigation without your taking the consent. So remember, for investigation, you need consent. So, okay, so is it okay? Patient says okay. So then you move to the next step. What is the next step? Okay, now what happens in investigation in the exam? Sometimes when you say this, we'll have to do this investigation, examiner will show the result. Okay, doctor, this is the result. Maybe chest X-ray, you said, examiner show the X-ray. Okay, this is the X-ray. What do you do? You look at the X-ray and then what do you do? Imagine it shows a consolidation on the right side. What do you do? Show the X-ray to the patient or don't show the X-ray to the patient? Show the X-ray.
Ask him whether he wants to see.
Ask him whether he wants to see. My question, do you think the patient will understand the X-rays? Can you, if you explain, can you understand?
Yes.
Yeah. So whatever you think patient can understand or you can make him understand, then you must show that. Will you show the ECG to the patient? Yes or no? Or not? Because you yourself don't know what it is. What must you do? Or you can ask the patient, do you know, we have done the ECG, but do you know anything about it? Can you see anything abnormal there? Because I don't know. If the patient doesn't, then you can ask. So do not show ECG. Will you show ABG to the patient? Will you show LFT to the patient? Yes. LFTs, TFTs, you have to show and explain. There are stations in the exam. AB is difficult to make the patient understand. Don't have to show. X-rays you must show. ECGs do not show. Some of the blood tests I told you must show. Okay, so you may talk about a lot of investigation. Examiner may not give every investigation. Some of the investigation he may show, some of the he may not show. So here, most likely he may show an X-ray. So show the patient, see we've done an X-ray. Do you want to have a look at that? Yes. So now, how will you explain? Imagine, how do you explain the chest X-ray to the patient? Sorry?
So you say this is your X-ray. As you can see, the areas that are black are normal. However, in the lower right side, this patch of white shows the area of infection. Okay.
What are you trying to say when you explain? What is the first thing you tell them? What is the first thing you tell them? What is normal?
Yeah.
First, you always say what is normal. Show them. Normally, it should look like this.
Yeah.
But can you see the right here? This is not normal. There's some problem. Okay, when you explain, always say what is normal first. Show the normal things first, so they can understand. Okay, can you see the dark areas here? For example, imagine this is the lungs. Okay, so can you see these areas all dark here? Normally, that's how the lungs look like. But can you see this area here, whitish? That is not normal. Okay, so that is because there's some bugs there. The infection which is causing that problem. Okay, so explain what is the problem. So show the X-rays and show the problem. Usually they don't understand. So that means most of the time when you're trying to explain, first you need to say what is normal. And one more thing, before that, examination, one examination told you sometimes you'll be looking at the vital signs. There may be a chart. Will you show the chart to the patient and explain the chart to the patient? Vital signs. Will you explain the vital signs to the patient? You don't have to show the chart, but do you need to tell the patient what is wrong? If the blood pressure high, will you tell the patient?
Yes.
If the temperature high, will you tell the patient? Yes. So don't forget that. Okay, so vital signs also sometimes you'll have to tell the patient, even if you don't show the chart. At least tell him, see, that is blood pressure which is quite high, or your pulse is very high, or temperature is very high. You need to tell that. So similarly, investigations also. Some of the investigation you must show and explain to the patient. Now, sometimes examiner will not show any investigations at all. Sometimes the examiner will show the investigation results. Okay. So now, the next step is definitive diagnosis. Now, how do you talk about the definitive diagnosis? That depends on whether the examiner given the investigation results or not. Imagine the examiner gave the results. Examiner investigation results. Yeah, you got it. Examiner gave the results. Yeah, examiner gave it. You got the results. Because examiner showed it. Doctor, this is it. You explain the result to the patient, then what do you tell the patient? See, this investigation confirms that you have this condition. Yeah, or this investigation shows that you have this condition. That's how we talk about the definitive diagnosis. The investigation confirms that you do have the condition, that is pneumonia here in this case. Okay. So that is if we get the results. But if the examiner did not give any results, no results, they did not give any results at all, then what do you do? In the exam did not give the results. So that means your station is finished there.
Schedule a follow-up.
After the
Schedule follow without
management.
in the exam.
Start treatment and wait for the results.
Yes.
Treatment for what?
To relieve his symptoms.
So just
Starting with
treatment for what? For a diagnosis, isn't it?
yes.
Yes. So my question is, what are you going to talk about that definitive diagnosis if you don't have the investigation? You still have to talk about the definitive diagnosis. How? If the investigation shows this, if the investigation confirms this is the condition, confirms the diagnosis here. If the investigation, use the word if the investigations, that means you still have to talk about the definitive diagnosis in the exam, whether you got the investigation results or not. Sometimes they give the results, sometimes don't give the result. Because if they don't give the result, you will stop there. So then you can't talk about the management. So that means even if they did not give the investigation results, yeah, what you say is if the investigations shows that you do have this condition. Yeah, for example, here imagine that you talk to the blood test, chest X-ray, sputum. Exam did not give any results at all. What do you tell the patient? Now, if these tests, what you've done, shows that you do have pneumonia, that's a definitive diagnosis. Okay, if things that you do have pneumonia, then what are you going to do? Then you talk about the treatment. Then you talk about the treatment. Now, treatment, how you talk is also very, 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 very important. Examination, after that, I told you what comes to the provisional diagnosis, then comes investigations, then comes the definitive diagnosis, then comes the treatment. Okay, so how do you talk of the treatment? What do you think the patient would like to know about the treatment? What is the first thing you want to know? It is treatable or not? Okay, is it treatable or not? Treatable or not? If it is treatable, what does he want to know?
How long?
Well, what is the first thing?
Whether he'll be in the hospital or hospital.
Okay, I'll come to that later. If it is treatable,
How long? What is the treatment?
this is what. Then comes how long. Okay, so treatment can be many things. Could it be medicines? We can treat you with the medicines. Yeah, because there are different ways we can treat. It could be surgery, it could be medicine, it could be lifestyle, so many things. So you need to say what is the treatment first. If it is a medicine, will you name the medicine? Will you name it? Yes? Or if it is the infection, will you name the antibiotic or will you simply say antibiotic? Name the antibiotic. Even if it is antibiotic, you should name it. The people who named it, they scored higher. If you don't name it, you don't score higher. Please name it. So even the antibiotic, please name. Most likely we be treating with this antibiotic. But who will decide on that? My consultant will decide. But you still name it. Most likely my consultant will give you this antibiotics. You name the antibiotics. Yeah, not only antibiotic, any medicine, whichever condition it is, any medicine, please name it. Yeah, we'll be treating you with this medication called this. Name the medicine. Then what do you do after that? Then you how to take it. Is it by mouth, tablets, injection, whatever it is, and how many times a day, for how long? You talk about all that. Then all the important thing you have to talk about. Side effects. I will come to that later when to talk. Let me just first finish the whole treatment part. Then we'll see. Okay, because that's another big part. So side effects. So every medicine has got 100 side effects. Will you mention all the 100 side effects?
No.
Which one you mention? Most common one.
Most serious ones. Serious. Emergency is more common. And some.
What is if it is if it can cause death? Very rare. Will you mention that?
No, most common.
Most common one. Not most dangerous one. Imagine that something is very dangerous but rare. Will you mention that? Yes. So that means you talk about the most common ones and most dangerous ones. Dangerous one, even if it's rare, you still have to mention. Okay, so mention the common ones and the dangerous ones. Dangerous one, as I told you, even if they're rare, you have to mention. And what do you do for the other side effects? What do you normally do for the other side effects? You can't mention each and everything. What do you do? Normally, what do you do? You tell the patient to read the leaflets. There are leaflets in every medication box. Check the read the leaflets. That's what you normally tell the patient. Okay, now, what I want is I want one of you to talk to me about imagine the same patient, Mr. Smith, got pneumonia. You decided to give antibiotics. Imagine you want to send him home with antibiotics. You didn't want to admit, you want to send him home with antibiotics. I want one of you to tell me about the side effects of, imagine you gave amoxicillin. You want to send him home, and you told him this is an antibiotic you have to take, called amoxicillin. You'll have to take by mouth 3 times a day, blah, blah, blah. You told him all how to take it. Then I want one of you to tell me the side effects. Who wants to do that? Tell me the side effects of amoxicillin. Talk to me. Talk to the patient, Mr. Smith. What's your name? Bokas. Talk to me.
Giving you these medicines called,
Louder, louder. People online.
we will be giving you these medicines called penicillins and
Amoxicillin.
amoxicillin. They can cause diarrhea.
They can cause some side effects sometimes. Like,
Diarrhea.
don't use the word diarrhea. Loose stools. Most of the time in the exam, they don't like this word. They what? They will ask you. So loose stool. It can cause loose stool, okay?
Allergic reactions like rash.
Let him talk. Don't prompt him.
Most commonly, and like in some cases, they can also cause a severe allergic reaction like anaphylactic reaction. And you have to talk, you have to say anaphylactic reaction.
I don't know. You are the doctor. Have you ever given amoxicillin to the patient before? Yes. So talk to me. I'm the patient.
Nothing British.
What you like?
Urdu, sir.
Talk to me in Urdu. Pushtu, then I can't understand.
Incoming call from Best Folk 9.
Did you talk about the anaphylactic reaction of the patient in Urdu or whichever language?
In Pakistan, we don't do that.
We don't do what you don't do. You don't talk of the side effect at all. Is it only in Pakistan? Yeah, back in India we don't talk about it. We hardly talk to the patient. We just say like this, yeah. Come back after 7 days. That's it. That's what we normally do. We don't talk. Why do people struggle so much to talk to the patient here? Why do people struggle so much? Because we don't have it in our blood. We've never done that before. We never speak to the patients. So this is where the problem is coming. Okay, so in the exam, where you have to talk to the patients. Okay, fine. Now, anybody else want to talk to me?
I'm Mr. Smith. I'm Dr. Hussain. I'm here to
Just the side effects of amoxicillin.
I'm here to discuss the medication I'm giving to you, amoxicillin. I'm going to discuss your side effects with you. Are you okay with that?
Yeah.
Have you ever had this medicine before?
No.
Okay. It's sort of antibiotic they're giving to you to kill the bugs you have in your lung. Normally, the side effects like it vary from patient to patient. Some people they do get upsets in their stomach and get loose stools as well. And other than these, there are some severe side effects as well, which is very rare. Some people have allergic to this penicillin group, amoxicillin. They do get some severe reaction, which is life-threatening. But we make sure we will test you before giving this medicine. You're not allergic to these sort of drugs. You don't have to worry about that. You'll be fine. Other than this, there's common thing with which I mentioned, loose stools, and you can make some rashes. If you are not allergic too much, it will be fine in 1 or 2 days. Anything else you want to know about the drug? Medicine, sorry.
Is there anything you want to tell me?
I mentioned the loose stools, and
Is there anything else you know other than the loose stools? Yeah. Sorry?
There's another side.
Okay, tell me.
Why it causes mouth thrush. In females, it causes genitalia thrush. So I'm just making you aware of this. It is less likely after a long time of using it. Sometimes it causes this thrush in addition to what other doctors say. So I think that's what I'm aware of. And if you have any doubt,